Okay, welcome to the Experience Better video podcast series, and we got a baby on here today, so we're going to do something a little different. We are here at Kearney Physical Therapy at the Children's Rehab Center, and I'm Josh Meekler, PT, and with me today I have Liz Weber, speech therapist, and Shelby O'Connor, an occupational therapist. And and then Kai, who is 2 months old, almost 2 months. He's about a little over 7 weeks. But we're going to talk about normal 2-month-olds and just kind of what they should do and what are maybe some things that we should be aware of or kind of have an eye on, right? Mm-hmm. So Liz, take it away.
Okay, so for your typical 2-month-old, speech, we do a lot of feeding. We look at the feeding, the swallowing, and then of course some of the basic early language skills. So with feeding, whether it's breast milk or bottle, babies at 2 months have the routine reflex. So what that is when you touch the cheek, they tend to move their head over it, and it's be the same thing as like if you're presenting with like a bottle or a pacifier. When you put that up towards their mouth, they'll start to move their mouth towards that. Mm-hmm.
So my baby didn't do it, Liz. Should I be terrified? Is there something wrong with him?
You should not be terrified.
Okay, good. Okay.
Side note, Kai already ate, so
yes.
He's good. So he shouldn't be doing that right now because that means he's not hungry.
Got it.
And so.
But that's a normal thing that they should do.
Yes. Yep. And especially you'll see it a lot during those feeding times. That typically babies will drink anywhere from like 4 to 6 ounces within a feeding, and with bottles. Just some big things are, like having the correct nipple. If, babies are kind of coughing or choking, that tends to mean that the flow of the nipple might be too big. They're not quite ready for it. But other than that, so typical feeding, every, 3 to 4 hours, depending on, the big thing is looking for like those hunger signs. Babies will start smacking their lips, start messing with their tongue, and then of course the basic cry,
right.
I am hungry, feed me now.
Yep.
And so those are kind of your main ones, just as a typical 2-year-old. One of the things that I have learned, it is absolutely normal for babies to spit up every single
right.
feeding. It can be kind of a nuisance, but that is typical, completely normal.
Doesn't mean my baby has acid reflux or anything like that. No. Typical, if it would be a sign of reflux, they're going to be like fussy and they're going to show more signs that it hurts. If they just have a little spit up and he's still a smiling baby, then you're just fine. Perfect. So Shelby, what do you got for us?
Well, with feeding, a couple main things is just like Kai was even doing is typical at this age that babies are bringing their hands to their mouth, putting both hands, they're not going to hold their bottle by any means, but they're bringing their hands up there when you're feeding them or to the breast. Some sensory development at this age for feeding to even consider is a lot of parents don't think about brushing or doing those sort of things until they're later, like getting into real foods. But it's beneficial to do like a small toothbrush and brush their gums and their teeth every so often just to kind of give them that sensory input through their mouth as well at this age.
Very good.
Yeah.
All right. So any big things that you'd be concerned about? At 2 months, you kind of mentioned that spitting up is normal, but eating every 3 or 4 hours if you're not doing that.
Yep.
How about, are there any other things that I should be worried about or freaking out about if something happens?
The biggest concern in regards of like feeding and swallowing is that if they're not consuming enough, and when you go for like your well checkups, if they're not gaining enough weight, that can be a sign that there's some concern.
Sure.
If they have continuous and every single feeding they're coughing, they're choking, right. That can be a sign of aspiration, meaning that it's going into their lungs, and so that can be contributing factors. Or again, like with the spit up, if it seems to be like excessive and they seem to be in pain and that it hurts them, then that would be a sign that it could be possibly more reflux than just your typical spitting up.
Gotcha.
So.
All right. Well, very good. Well, thanks for joining us along today, and we'll probably be seeing Kai in some more videos as he grows and gets older, and you'll teach us more about more of the speech and feeding related things as he develops. So, all right.
Perfect.
Thanks, everybody. So